fix the sound here. Don't want it to be. Terrence Bro is in the building. Mega love shout out to Terrence. Oh, are you, sir? Welcome, welcome. Happy to see you. Happy to see you, brother. And Kyle in the building as well. Saying mega love shout out to you. Thumbs up done coming from Terrence and Kyle. Hey guys, how you all doing? Thanks for coming. Oh, my clothes look so Pamela as if me I show up myself. I can't show up myself, you know. Guys, thanks for coming, man. Happy to see you. Let me just share up myself here. Right? Let me just show up myself here, guys. Sharing up myself. Coming. Alright, so I shared out myself. Let me see who and who is in the building. Yeah. Oh, me look so red. Oh, me look so red. Okay, so Coil is here. Let me see. Let me see who and who in the building. We have vibes with Maria Coleman in the building, waiting patiently, she says. Welcome, Maria, sweetheart. Welcome, welcome. Make a love shout out to you. Let me see what's going on further. You see, me don't like up on this phone, you know, this phone touches things that I don't want it to do. Right? Touches things that I don't want it to do. Alright. Okay. So we have Maria in the building. We have Terrence Maguire in the building saying mega love shout out, and he drops his link as well as Kyle. And Kyle drops his link as well. Yeah. Welcome guys. Welcome in. Welcome in guys. I should have got that thing there, you know, and pin it here, so. Oh well. Why didn't I got that? Right? Why didn't I got that? I'm coming guys, I'm coming. Let me just set up myself. Okay. Alright. Let me see who is in the building now. So Kyle is saying, oh, thumbs up my video. No worries, man. No worries, Kyle. Don't worry. So we have 1 million people in the building. 1 million people in the building. You are here, Kyle? And he's saying everyone, hello everyone in the chat. And he's saying no problem, I'm waiting. Alright. So I'm here now, guys. Where are you guys? Alright. So Kyle said please thumbs up is alright. So guys, come in. Let us learn together, guys. Come in, guys. Come in. Who is here? Show no face. Active troops in the building. Saying that she checking. Welcome, Troopsy. Welcome. Mega love shout out to you. Thank you for that beautiful thumbs up. How are you, Troopsy? Check. I see them, Choopsy, those check, check, check. Okay, welcome. Thanks for coming. Glad to have you here. Yes, I appreciate you all for being here. Mega, mega love shout out to you. Who is in the bush? Who is in the bush? Who is in the bush? Show up your face. Show up your face, guys. Bunny is in the bush. Bunny jump out the bush. Saying self-care. Hello. I know someone was in the bush. Welcome, sweet bunny. Welcome. Thanks for coming. Yes, glad to have you here, my friend. And she is saying, I'm here, but a little bit vulnerable right now. Very close to tears. What happened now? Oh, is daddy? Oh, is daddy, bunny? Let us know how is daddy, because they say that you were taking him to the doctor on Sunday. What's going on now? Don't tell me anything that's bad though. Tell me that daddy came back home and well, right? Hey, bunny. So Bunny is saying maybe not speak about daddy. The update is not okay. Alright, alright. I understand. It's not. Oh my goodness. Praying for Bunny Father at this time. Lord, watch over him and give him strength. Father God, guide and protection. Healing, I call upon him. Heal him, Jesus. Touch where it is hurting. Healing, healing. Yeah. So Bunny is saying, I'm here but a little, yes. Maybe not, yes. He's home, but things aren't great. Alright. Amen, amen. Oh my goodness. Sorry to hear. Sorry to hear. Choopsy is saying, blessing, Chad. Blessing to you, Choopsy. Active Choopsy is here saying, blessing to the chat. Yes, Choopsy. Mega love shout out to you. Where is Maria? Where is Maria? In the bushes? Maria always be the first one in the live, but I think she's in the bushes. So we have 5 million people in the building here, and we're going to talk about scoliosis. Yes, guys. You know that curve that is seen person's back. You know, when you're on the street or you may have a family member or maybe a friend who has their spine kind of twist. Yes, you see them shape, you know, like one shoulder up and one shoulder down. That's what we call scoliosis. Not all the time it is a scoliosis, you know, but we're going to speak on scoliosis tonight, right, guys? We're going to learn together. Okay, so here we have Kyle in the building. Say, Choopsy, big up yourself. Yes, Choopsy, big up your nice, clean self. And Bonnie saying, I have been staying happy during the day because it's not easy and I don't want to bring more stress. Okay, you come to the right place. Bonnie, you come to the right place. We're going to deal with stress right now. We're going to let you laugh it off and forget all about that, right? You have to be joyous in sad times, you know. When I'm sad, I cried. And when I remember Jesus, I wipe my tears and say, no, don't cry. Because if I cry, I'm going to be depressed and stressed. Yes. So I try not to cry and try not to stress myself. My husband tell me, say, must not think about anything. Because I'm telling you, when I ready to go stressing up, me I tell you, man, every limb in my body crumble down. Pressure, pressure. So me try not to think about the negative thing. Try to be happy. Try to talk about God, you know, for me to be relaxed and so on and so forth. So here is Bunny calling out Sweet Pea. Yes, call out Sweet Pea, sweetie. Let us laugh off the stress tonight, Bunny. And Bunny is saying, I see she's not here today. She's in the bush, man. She always here. She's in the bush. And Natty is in the building. Welcome, welcome, my sister Natty. And she's saying, hi, self-care present. And Bunny saying, Natty, hey, beautiful. And here is Natty calling out to Terrence. And Bunny is there. Natty saying, good night. All right, guys. So go and call and heal up on yourself. Choopsy is in the building, guys. If you don't have Choopsy, what are you guys waiting for? Connect with Choopsy. Look in the building here. When you see new persons come, guys, don't let they leave. Right? Where is Maria? Where is Jadon? Guys, coming, coming, coming. Oh my goodness, here is Barney in the building. Let me give Barney a jacket. Yeah. Barbie, yes, Barbie, welcome, welcome. Mega love shout out to you, and she's saying thumbs up. Big up your nice clean self, Barbie. Thanks for coming. Yeah. So guys, go and talk to no one another. Go and converse while I go on to tell you about scoliosis. And at the same time, guys, if you have any topic that you want me to come back with at a later date, let me know. So for now, oh, Yummy Kitchen is back in the building. Welcome back, Yummy Kitchen. Welcome, welcome. Guys, grab the new persons, them that are coming in. Where is Maria? Where is Jadon? Natty, grab, grab, grab. Right, connect, connect, connect. Right, guys? Yeah. So, Barbie is in the building. Barbie, please look out, look around and see who you don't have. And there is Kitchen, Yummy Kitchen as well. Kyle, if you don't have Yummy Kitchen, what are you waiting for? Guys, Choopsy is here also, a Jamaican. Yes. Grab, grab, grab. Connect, connect, connect. And my sweet, sweet, sweet pea is in the building. My sweet, sweet pea is here. Bonnie called out Sweet Pea, and Sweet Pea came running. Okay, Sweet Pea, I'm so happy to see you guys here. All right, so you guys can continue to converse in the chat while I try to elaborate on the topic here on scoliosis. So let us learn about scoliosis, guy. Right? And Sweet Pea is saying blessed self-care. Yes. So scoliosis, guys, is a person with, it said a person with scoliosis will have a sideways C or S shaped curve in their spine. Hear that, guys? A person with scoliosis will have a sideways C or S shaped curve in their spine. For a doctor to diagnose scoliosis, the Cob angle, a measurement or a measure of the curvature must be at least 10 degrees. So they are saying for a doctor to diagnose scoliosis, right? The Cob angle, a measure of the curvature, must be at least 10 degrees. Right, guys? So here I'm going to show you what the scoliosis look like and the Cob angle, right? So here it is, guys. Hope you all can see. I try to draw it, right? So this is the, oh my goodness, the writing coming up. I hope you guys can see. The writing coming up in the chart, right? So here is the vertebrae, guys. So this is the vertebrae, yes. This is our vertebrae, right? It's supposed to be straight, but this is the scoliosis vertebrae, right? So this is a vertebrae, and this is what they call the Cob angles. They use these angles to measure the size of the curve, right? In order to diagnose the person with scoliosis. So this is the angles that they use. So the angles called Cob angles, right? And this is the spine of a person with scoliosis, right? Right. So here they're saying someone is considered to have scoliosis when the spine has a sideways curvature of at least 10 degrees. So once the spine curve and measure 10 degrees, doctor diagnose you as a person with scoliosis, which is measured by the Cob angle. So you have to use the Cob angle in order to diagnose you, right? So with the measurement, doctors are able to judge the severity of the scoliosis, assess the curve, and recommend treatment option, right? So doctor have to assess the curve in order to say, yes, this person has scoliosis, and then he comes up with a plan for treatment, or to get back the spine, or to get back the vertebrae in a straight line, so that person have a straight back instead of they twist like this and walking in the street twist up like this. Doctor comes up with a plan and treatment to let them come back like this, right? Right. So guys, are you understanding what I'm saying? And at the same time, guys, if you have a topic that you want me to come back with at a later date to discuss, you can let me know. All right. So that's it about the Cob angle, for a person to be diagnosed with scoliosis. So let me see what's going on in the chat. Our person's been saying stuff and the chat is running away with leave me. All right. Blessing, self-care and all coming from Sweet Pea. Bobby said, not great, but not focusing that. All right, my sweet Bobby. Just take it easy, right? Bobby and Bonnie. Sweet Pea saying, I try to limit it because speaking about is really... All right. So here is Natty saying, your ads were short today. Oh, okay. All right. So Yummy is saying, Sweet Pea, all right. Bonnie said, told you, Bonnie. Told you, if Bonnie calls, she running. All right. If Bonnie call out Sweet Pea will become running. I know. It take Bonnie to call out Sweet Pea from out of the bushes. And Natty is here. And Yummy is said, how are you, Bonnie? All right. All right. So they are conversing there. Continue, guys. Be happy. All right. All right. Oh, blessing. Yes, so Maria came out the bushes. Welcome, welcome, Maria. Maria, if you see Chupsy in the building there, she's somewhere in the chat here. Connect with Chupsy, right? Yeah, and there's Natty. All right, like I said, I have Natty already. Natty is calling out Maria I. And here is Yummy. Yes, if you don't have Yummy, Maria, come on, connect, and grow. So Yummy is saying okay to Bonnie, and Vibes is saying I have topics. I have okay, Vibes. All right, put your topic aside for a while and let me go through this one first, right? So she's saying I have a topic. And here is Bonnie saying Yummy. Okay. So Valley is in the building. Welcome back, sweet Valley. Mega love shout out to you. And here is Vibes saying, I'm finishing up my SBA. Okay, so Vibes are still going to school. That's nice. All right. What topic you finish up your SBA on? What you studying? And here is Bonnie saying, hi, Valley. And Sweet Pea is saying, yes, Bonnie, say, come. And Valley say, oh, so how are you doing? I'm fine, I'm good now that I see you all in the building. Now that I see you all in the chat, I'm excellent, guys. Human and social bio. Oh, you doing nursing? You doing nursing, sweetie? And geography? What else done? Human and social bio and geography. Okay, cool. You're doing well, man. Vibes there. Oh, are you doing all right? Oh, you doing pediatrician? Oh, yeah, going good, man. You know, for the only pediatrician. What, in RN? If it's practical nursing you're doing, you must do the whole full thing, man. Pediatrician, geriatric, mental illness, everything that covers practical nursing. So when you go out now to get a job, You know, you can pick, choose, and refuse. Yes, don't study only pediatrician when you just know that you're going to work with children only. You want to know when you go out there to look at job, you know, if you can't find anything pertaining to children, then you may find something pertaining to the geriatric. If not, you find something pertaining to, you know, to another, you understand, another part of the nursing, right? So don't just do one something. Just do the whole entire practical nursing, right? PN. All right. So let me continue with the topic now. So scoliosis can appear at any age, guys. They are saying scoliosis can appear at any age. I think I saw walking purpose coming, guys. Welcome the persons them in the house for me. Welcome, welcome, mommy walking purpose. One love to you. Mega love shirt out. So guys, and look out for the monkey as well, guys. Look out for the monkey that comes to eat all of us bananas, right? So they're saying right here, says scoliosis can appear at any age, guys, any age, but it often presents between the ages of 10 and 12 years, right? Or during a person's teens. You hear that, guys? They said scoliosis can appear at any age, but it often presents between ages of 10 and 12 years or during a person's teens, right? While scoliosis is rare in infants, while scoliosis is rare in infants, infantile scoliosis can affect people before the age of 3 years old. So they are saying right here now, scoliosis can affect babies, right? Not not saying that they have to reach 10-year old and going up. Teens. It started from as young as baby, right? People with before the age of 3 years. So it started so young before the age of 3 years old and it go further up, right? So scoliosis started from baby stage, right? So in most cases, there is no known cause of scoliosis, right? In most cases, there is no known cause of scoliosis. Doctor call this idiopathic scoliosis. Doctor call this idiopathic scoliosis because they don't know what really caused it, right? So idiopathic means unknown. They don't know what caused this sickness, right? This curve in the back, right? This C or this S shape, right? So in other cases, scoliosis may have an association with cerebral palsy, right? Scoliosis may have an association with cerebral palsy, right? And cerebral palsy means having to do with brain disorder, right, guys? Cerebral palsy has to do with brain disorder, so it affects the brain, you know. Um, while the baby in the mother womb, the brain not developing up properly. So you call this some tubal birth defect. Yes, tubal birth defect. So why these problem really cause these disabilities comes in is because mothers got pregnant. You know, when you get pregnant, you're supposed to go to the clinic, right? Go whether to the clinic or the hospital to start get treatment. From you find out that you are pregnant, right? You do the blood test, doctor tests you up all over, you know, start treat you, find out if you have any sickness, if you have any genetic, you know, inheritance and so on and so forth. So to treat you that they find out if the baby will comes with any genetic problems as well, right? And they make certain that they eat certain foods, in order for the baby develop properly. They told you what to eat, and they tell you that you must take iron tablet and so on and so forth. So if you got pregnant and stay home for the 9 months, not going to the hospital or going to the clinic for a doctor to assess you and treat you and all of these things, your baby will become deformed. Yes. 3/4 of the cases, your baby must become deformed because you're not getting the care that you're supposed to get, right? So let me read the chat if anybody have anything to say about what I'm saying here, right? So that's where birth defects comes in, and one of them is cerebral palsy, right? All right, so they are enjoying themselves there. Okay, I see my friend Eugene in the building. Eugene in the building. Guys, remember, you must welcome in new visitors when you see them, and Nugent is one. Hi Nugent, how are you? Mega mega love shout out to you, and he's clapping all the way, saying the road is to happiness. Hello everyone. Okay, Nugent, and I see where Natty is welcoming Nugent. Yes, guys. And connect when you see the new persons them coming. Nugent is my bro. So guys, connect. So yes, they're saying scoliosis in other cases, scoliosis may have an association with with cerebral palsies, right? And muscle diathropy, right? Scoliosis are so associated with muscular diathropy, and muscular diathropy is weakness of the muscle affecting shoulder, weakness of your muscle affecting your shoulder going down, so you're walking and you sit like this, right? So that is muscular diathropy. Your body weak, your shoulder weak, it cannot stand up like this firm as how it's supposed to be straight, right? And your pelvic muscles are weak. Your pelvic in your grinder, so that connect with your two legs, that's where the pelvic area is. So the pelvic is weak, right? And you have difficulty raising up, difficulty raising up from sitting or lying position. So that's what you call muscular diathropy. And muscular diathropy is when your muscles are weak, right? Shoulder drop like this. You cannot walk because your pelvic area, your grind is so weak. So your bedridden, you're confined to the wheelchair, you're confined to bed, right? So that is muscular diathropy, or spina bifida, right? Or spina bifida. And spina bifida is a condition that affects the spine and is usually appears at birth, right? Yes, a condition that affects the spine and usually affected at birth. That is spina bifida. Guys, as soon as you find out that you are pregnant, you have to go to the clinic or the hospital so they can start treat you right up to your 9 months of pregnant or 7 months of pregnant when you're ready to go into labor. If you stay at home and hide from the doctor, not getting the vaccine that you should get and all of these things, your baby will come, abnormal. In other words, disabled. Yes, guys. So, pregnant woman, please go to the doctor, go to the hospital, start your antenatal care in order for your babies your babies to appear in this world, so to speak, in normal, normality, right? Look normal like everybody else, right? No disabilities, right, guys? Right. So that's what they're saying, that doctor call this. So in most cases, there is no known cause of scoliosis. Doctor call this idiopathic scoliosis. In other cases, scoliosis may have an association with cerebral palsy, muscular diathropy, or spina bifida. Alternative, it may Alternatively, it may be a birth abnormality, right? A birth abnormality, right, guys? So what's going on in the chart here? What's going on in the chart here? All right, so guys, enjoying yourself. All right, all right. I see Natty welcoming Miss Monica, welcoming you, Jen. Yes, I see you guys. Vibes welcoming you, Jen. That's nice, that's nice. And she's a nurse. Ooh, who is saying that? Natty saying she's a nurse. Okay, all right. And here is Natty saying, Maria, invite you already. All right, all right. So guys, keep it up, keep it up. Thank you. Bonnie is calling out to new Jen. Yes, yes. But I say I have a cousin that have that sickness and it's not easy. Yes, vibes. Woo! Oh my goodness. So you're learning something here, vibes. Yes, it's not easy. Your spine twist, S shape or C shape, not easy. So here is saying Natty Slim, sure. And here is Natty Slim say return. All right. So walking purpose, he say, hey Natty, good, good, good. And Yomi say vibes with my all right. Okay, so you guys are doing perfectly well. Remember guys, look out for the monkey. Okay. Nice, nice. And here is Bali saying, Natty, hope you are alright. Guys, please, alright, cool, cool. And DLC in the building. Guys, remember to thumbs up the live. Welcome, welcome back, DLC. Mega, mega love shout out to you. Happy to see you as always. Keep coming, guys. And Bonnie is welcoming DLC. Yes, cool, cool. Yeah, sweet. Okay. DLC saying, I Bonnie. All right. And here's Wally drop her link. Thank you, guys. Guys, remember to thumbs up the house. Okay, guys. So let me go back now to the notes here. This is so nice. We are learning something tonight about um, scoliosis, right? So the note is saying here that doctor will classify spinal curves as structural or non-structural, right? So it's saying that doctor will classify spinal curves as structural or non-structural, right? So it's saying here a structural curve is permanent and may be due to a medical condition or injury, right? That is a structural curve. Then they say no, a non-structural curve is temporary, meaning that the spine is structurally normal. In other case, a doctor will try to find and correct or treat the cause, right? So the non-structural curve is temporary. It is temporary, meaning that the spine is structurally normal. In either case, a doctor will try to find and correct or treat the cause. So this one can be treated, they say, right? And doctor classifies spinal curve as structural or non-structural. A structural curve is permanent. A structural curve is permanent and may be due to a medical condition or injury, right? Treatment. Treatment now for scoliosis. In most cases, childhood and adolescent scoliosis is mild and does not need treatment. You hear what they're saying, guys? In most cases, childhood and adolescent scoliosis is mild and does not need treatment. With a curve of 10 to 25 degrees A doctor will usually have check-ups with the person at 3, 6, or 12-month intervals to check whether the condition is changing. Right, guys? So, once doctor find out that the child has a curve, right? He try a curve of 10 to 25 degree. He keeps up with, the child should keeps up with doctor visit, right? In order for the doctor to correct that curve, right? So the checkup with the person, so the doctor will check up the person every 3 months, 6 months, or 12 months interval, whether to see to see if the condition is changing, because he said that it can change, it can be treated in a child, right? So the child would have to visit the doctor every 3 months, 6 months, or 12 months, for the doctor to see that he is straightening back, right? The treatment that they give. So the child is coming back, right? The spine is straightening, right? For a 25 to 40 degree curve, a doctor may recommended bracing, right? So they say that for the curve, let me show you guys something here first, all right? So here they say this is a normal spine, right? This is normal, right? Normal. And here is abnormal. This is the scoliosis, right? This is the scoliosis spine. So you can see the C curve and the S. You can see a S in it as well. Scolosis, right? And here is right there, the bottom one there is where the shoulder, muscular diathropy, so the shoulder drop and the spine is twist as well. The vertebrae there twist. You see it in the side here where the spine is? Yeah. Right. So you guys have an idea what I'm talking about when the vertebrae is twist. Right? Yeah. Okay, so let me go back around here now. Yeah. So the doctor says no. For a 25 to 40 degree curve, a doctor may recommend braces, right? So it depends on how the back curve or its shape, right? A 25 to 40 degree curve in the back, doctor will recommend braces. If the curve is greater than this and the skeleton is still immature, a doctor may recommend surgery, right? So if the curve is greater than 25 to 40 degree, that means say gone, the vertebra gone, it twists up, right? Right. Doctor will recommend bracing. If the curve is greater than this, the skeleton is still immature, right? And doctor may recommend surgery. Ah, terrible. You can imagine your spine twist and your shape like this and you're walking like this for your rest of your life, you know? Spine and vertebrae, everything twists up from it, up in the neck coming down. Oh my goodness, you have headache, brain problem, everything wrong with your foot problem, from your toe to the sole, from the sole of your foot to the crown of your head, you feel pain, guys. Yeah, man. Sickness is terrible, guys, terrible. The doctor will consider the following factors when deciding on treatment option, right? So it's saying here, sex. Females are more likely than males to have scoliosis that gradually got worse. So they are saying here, female are more likely than males to have scoliosis, right? That gradually worsen, right? Then they are saying now severity of the curve. The type and severity of the curve may affect how it progressive, right? S-shaped curves are typical in those with idiopathic scoliosis and known. So they are saying the persons with S-shape idiopathic scoliosis and known doctor can't find the cause. So whereas C-shaped curves are more common among those with neuromuscular sclerosis, right? So the C-shaped curve have to do with person with neuromuscular sclerosis, right? So it coming from up in the neck here, go down, neuromuscular, it's weak, right? Sorry guys, sorry. Right? So that is severity, right? Severe, right? Severity of the curve, the type of and severity of the curve may affect how it progress. The type and severity, right? S-shaped curve are typically in those with idiopathic. They can't correct it and know, they can't find nothing for correct the S shape, right? Whereas C shapes curves are more common among those with neuromuscular sclerosis. So curve position now. A curve in the center part of the spine is more likely to get worse than a curve in the lower of the upper section. Right, guys? Curve position. A curve in the center part of the spine, that is below, down at your bottom, down there, so, is more likely to get worse than a curve in the lower or upper section. So the curve down to the lower part of your back there down to your spine, it will be more likely to get worse because of lifting and all these things, and then you're not lifting properly, so the curve will get worse over time, right? So bone maturity, the risk of worsening is lower if the person bones have stopped growing. So they're saying bone maturity, the risk of worsening is lower if the person bones have stopped growing. Braces are more effective while the bones are still growing, right? So while the bones are growing, they say that braces will work, in helping to straighten the back. You understand? So the risk of worsening is lower if the person bones stop growing, right? Yeah, right? Let me see what's going on in the chat. We have 5 million beautiful people in the chat. Welcome everyone. Make a love shout out to you. Thanks for coming. Yeah. So here we have Yomi saying good night at Bonnie. Okay, Yomi. And here is Yomi saying okay at Valley. And here is Walking Purple saying body cute. Alright. And Genius in the building. Welcome back, Genius. Mega love shout out to you. And Walking Purpose is saying, I Kyle gifted yesterday, alright. And Uniquely Blessed is in the building. Welcome back, guys. Mega love shout out to you. And here is DLC calling out to Uniquely saying, hi. Welcome all 6 million people in the building. Yes. So we're going to talk about casting now. Casting is that, I think, is that white thing that they put on your hands when your hand break or so. That's casting, right? So in infantiles, in babies, they're saying in infantile scoliosis, a doctor may use plaster casting, right, instead of bracing to help the infant's spine. So here they're saying now, in infantile scoliosis, A doctor may use plaster casting, instead of bracing to help the infant's spine, right, grow into a typical position. So in infant, the doctor will use casting to hold the spine to grow in a position that he wants it to set, right? Right. So the cast attaches to the outside of the infant body, and they will wear it at all times as most infants grow rapidly. So they are saying here the infant have to be wearing the cast at all times because they grow fast. Can you remember says children them in and them have to grow. So they grow rapidly, so them have to always wearing their cast. So the doctor will need to change the cast regularly. Yes. Because the children growing, so the growth when they getting bigger and whatever, so they have to extend the cast or whatever, right, while the children them are growing, right? Because they can't put on a baby cast, maybe a 9 months old cast and a 2 months old baby. Can remember say the body mass of the baby is getting bigger, right? So you can't put on that 9 month old cast on a 3 year old child, right? So they have to be changing because the child is growing rapidly, right? Children, right? So here they're saying bracing now. Bracing. If a person has moderate scoliosis, right? And the bones are still growing, the doctor may recommend a brace. The brace will prevent further curvature, but it will not curb or reverse scolosis. You hear that, guys? The braces will not reverse scolosis. Let me read it again. Bracing. If a person has moderate scolosis and the bone are still growing, the doctor may recommend a brace, right? The brace will prevent further curvature, right? It will keep the body in shape, right? Any growth are coming for curve, it just grab the body and shape the body because the bone is still growing. So what the doctor do is um what should I say, training the bone to shape how it's supposed to shape, right? The vertebrae, right? But it will not cure or reverse scoliosis. It will not cure it nor reverse, but at least they will try to, shape up the body so the body not look too much curvy. So the person will usually needs to wear the brace all the time. Just imagine you're wearing brace or cast all the time. Huh? All the time. Even at night. Even when you got your bed. Them say you have to wear the brace. Eh? It's effective. Its effectiveness tends to correlates with the number of hours per day that the person wears the brace. So them say it is effective. It correct, you know, the number of hours the person wearing the brace. So they're saying overall it is effective. You should wear it every day, right? When you're going to sleep, because them say night too. So I guess when you're going to your bed, just imagine that uncomfortableness. Oh my God. Huh? So the brace does not generally restrict what the person can do. Here they're saying the brace does not restrict what the person can do. So you can run, you can do any little thing same way. If they wish to take part in physical activity, wow, they can take the brace off. You hear that, guys? If the person wish to take part in physical activity, meaning to go and exercise, they can take the braces off, go and do their exercise, or whatever and come back and put it on because it have to be on. So that is great. That's good news there, right? There are two types of brace, right? There are two types of brace, right? Therocolumbo boscastral. Guys, these words want to twist up my tongue to call. Thoracolumbo-sacral arthropiece, arthro, arthrosis, thoracolumbo-sacral arthrosis. That's one of the braces, right? And this the acronym is TLSO, right? Thoracolumbo-sacral arthrosis, right? So the TLCO, the short abbreviation, is plasket, right? So they say it's plasket. So this brace is a plasket brace, right? It's a pity I never have the brace to show you guys, right? And its design means that it fits neatly around the body, curves. It is not usually visible under clothing. So this is nice. This is a nice brace, right? There are two types of brace they're saying. Thoracolumbo sacral arthrosis, short acronym TLSO. The TLSO is plastic and its design means that it fits neatly around the body curves. This is not usually visible under clothing. So guys, we see many people out there walking with their sickness and we don't know what's going on with them, Lot of person, because this type of braces fit the body well, right? And they just put on their clothes and you can't tell them say they're sick. You can't tell them say them back curve, them have curve problem because this one holds the body together and you can't know because it come like a one of them belly banding. You can't tell if the person have a belly band or whatever. It fits so nice. They're saying here the plastic, yeah, thoracolumbo's circle arthrosis. That type of braces fits well. All right, let me see what's going on in the chart here. Let me see what's going on in the chart here. Yeah. Let me see. Okay, so I see Ishmael in the building. Welcome, welcome, my bro Ishmael. Mega love shout out to you. Thanks for always coming. My brother here, yeah, from India. And he's saying hi to all my people in the building. And here is Monica saying, Gino's family. All right. And here is Ishmael saying, have a great day, host. You're going already, Ishmael. Hey. And here he dropped his link. And Valley Q saying, yummy. All right, cool. And Ishmael said, I'm supporting from India. Yes, guys, he's from India. When you see new people comes in, guys, connect, connect, connect. So, guys, connect to my bro here, Ishmael. All right, and Ishmael, please return, return, return. And Walking Purpose is calling out to Ginny Vinny. And here is Ishmael saying, just connect me, all right? And Valley is calling out to Ishmael. And we have James Gibby Gibby in the building. And he's saying thumbs up. And he drops his link. Welcome, welcome back, James. And we have Dear Vin, Dava. All right, Diana Vin. All right, whoa, Diana Vin, Abdul He's from Indian as well, and he drops his Mighty Amuji. Welcome back, welcome Davina. Or right, Danavin. All right, welcome back, Danavin, and he drops his emoji right there. And Yomi is saying, Bunny, I'm back, and Danavin drop his emoji again, and here is saying, bye bye, friends. Okay, sweet Danavin, thanks for coming. Please make a love shout out to you. All right. And Valley drops early. All right. And Valley saying Yomi, and Yomi is calling out to Ishmael. And Walking is saying hi James. And here is Yomi saying Valley. And Yomi is calling out to James as well. And here is Walking Purpose saying Ishmael. All right. And she drops her link as well. And let me go back to the notes here while you guys go and do the thingy, right, guys? And here we have the notice saying Milwaukee Brace. So there is a brace name, Milwaukee Brace, for scoliosis, right? This type is a full torso brace, right? That has a neck ring with rest for the chin and the back of the head. So Milwaukee Brace, guys, Milwaukee Brace. That brace, have you ever seen someone meet in a car accident or some form of accident that shake up the back or so? You see them with a brace under their neck come all the way down here, and it holds up them head and straighten the neck come down. Its name is Milwaukee Brace, right? This type is a full torso brace that has a neck ring, right? The rest for the chin, rest on the chin here, hold up the head, right? And the neck of the head, right? So they call it the Milwaukee Brace. Doctors reserve the use of the Milwaukee Brace for when the TLSO is either not suitable or not effective. So if the TLSO, which is the thoracolumbocercal orthosis, right? TLSO is not suitable for this type of scoliosis. The doctor used the Milwaukee Brace, right? So that one, you hold up the neck like this and straighten. Yeah, right? So chiropractic treatment. So chiropractic treatment, some people visit a chiropractor to relieve the pain and discomfort of scoliosis, right? So chiropractors manipulate the spine and provide alternative treatments, right? They maintain that realigning the spine will promote healing and well-being. So the chiropractor, when you go to the chiropractor, you know, turn and, fix you and shape you, try to fix it, your spine in a position where it's supposed to be, so you manipulate it and, yeah, you stir it up and realign it, put it back together, yeah, to promote healing and well-being. So the spine get out of line, get out of its rightful shape. So you go to the chiropractors now who will treat you realigning the spine, fit it back in its position, set it right to maintain healing and well-being. So the chiropractic treatment may improve the quality of life for a person with scoliosis. However, it is not a curve as it does, not resolve the curvature of the spine. So it said, however, it is not a curve as it does not resolve the curvature of the spine. Okay, so people who wish to visit a chiropractor should take care to select one who specializes in scoliosis. Receiving chiropractic treatment from a non-specialist can make symptoms worse. So a person with scoliosis needed somebody to align back the vertebrae, right? To come back in shape. Should be careful of who they visit, saying that they are a chiropractor, right? Because they will get it worse, pop out the rest of the little spine will left back with you, you know. So you have to be careful and seek the right specialist. Yeah, ask your doctor to send you to a specialist, right? No go pick up, you take up yourself and make somebody who don't know about these things tell you say, go on to the um, you know, physiotherapy there, whoever, we don't really know anything about, you know, aligning the spine and make your body go get worse, make you disabled and bedridden, you know, make you confined to bed and wheelchair. You have to be careful. A person with um, scoliosis. So they are saying now exercises, right? Various exercises may help with scoliosis, and experts propose a range of strategy. However, they all aim to realign the spine, right? Ribs, shoulders, and pelvis to achieve a typical posture, right? So they are saying that various exercises may help with scoliosis. So a person with scoliosis should find a proper, let the um doctor will send you to therapy, right? The doctor will send you to therapy. You know, pick up yourself and go find a therapy for your own. Ask your doctor, person with scoliosis, ask your doctor, or the hospital will tell you say to go to the hospital gym. They will refer you to their hospital gym because they are still responsible for you. Once you're there in their care, they will say, go to the gym, right? The hospital gym where they have a lot of therapists, right? So various exercises may help with scoliosis. An expert propose a range of strategy. However, they all aim to realign the spine, ribs, shoulder, and pelvis to achieve a typical posture. Right, guys? So you go to the specialist, the physiotherapy, and they will give you exercises that helps to align the spines, the ribs, the shoulder, and your pelvic area to achieve a typical posture. So to make your body come back straight and normal, you know, it maybe not 100%, but at least it's getting there, right? In severe cases, scoliosis can progress over time. In these cases, a doctor may recommend spinal fusion. This surgery reduces the curvature of the spine and prevents scoliosis from getting worse, right? So they are saying in severe cases, scoliosis can progress over time. So they are saying that scoliosis can, you know, your body can straighten up over time. So if it now take 1 day, 2 day, 3 day, 1 week, 2 week, a month, 2 months a year, over time, mean it continually, it gradually take it time, years, to, for you to see changes, right? Yeah. So it don't just come at once. It take years with exercise, going to the therapy, you know, and doing your thing. Your body will gradually, you know, looking much better than how it was, right? So a surgeon may use metal rods, hooks, screws, or wires to hold a part of the spine straight while the bone heals. So you hear what they're saying? Surgeon. When you go, person with scoliosis go to the surgeon. The surgeon uses these methods, right? They use rods, guys. They use hooks. They may hire now, metal. Rods, hook. You that things I carry my work pan is a mechanic. So the surgeon uses rods, hooks, screw. Guys, screw up your body. Yes. Straight while the bone heals. Just like when a person get a broke foot or a broke hand, they put the iron back into the hand to get the hand to straight or the foot, and screw up the iron to set the bones back in position for you to get back you know, your hand like this, right? Yeah, man. So they use hook, they use rods, they use screws, and wires to hold a part of the spine straight while the bone heals. They may also use bone grafts to help the bone heal. Yeah, man. So you see doctor out there every day. Doctor mechanic too. Doctor man a fall trade. Yes. Him a mechanic. Him a what? Carpenter. Yeah, him a plumber. Because all of them something they come back into the hospital. Guys, believe you me. Yes. We are doctor have to invent things to use. Mm. Sometimes the patient on the bed, and we want the bed to rise up because the patient is complaining that the bed too flat and him can't breathe. But the bed can't raise up because it not have the thing, the lever for wind up. It not have that winding system. It's just a normal bed. So what we do? We implement things. We invent things. We're going to look too big stone. Guys, we're going to look too big stone and put it under the mattress. So the head of the mattress raise. Yeah. Rise up the head of the mattress. And then put back down the mattress and spread the bed. Yeah. So in order for the patient to be comfortable and start to breathe proper, we have to come with things, little things. It's not everything hospital can buy, government can buy. Because by the time them hard at it, the patient that got dead, the patient dead long time, 10 times. So we have to use our head fast as person in the medical field. Think quick. Yes. Yes, because not everything you can buy. Right? So to save one's life. Okay, guys? So here I say now. Yes, so they are saying now, children can usually go back to school after 4 to 6 weeks and can take part in sports after between 3 or 6 months. They should avoid sports that drag the back. So they're saying a child can usually go back to school after 4 to 6 weeks and can take part in sports, right? So they're saying after surgery, after the doctor screw up and wire up and fix up, the child can go back to school after 4 to 6 weeks and can take part in sports. So it do not it does not prevent them from doing physical activity, right? Because it already tighten up and screw up. So the child can go back and try to do, normal active, like any other child, right? So between 3 and 6 months, right? Between 3 and 6 months, the child can, 4 and 6 weeks, can take part in sports. After between 3 and 6 months, they should avoid sports. So after a while, they should avoid sports, not to ackle up the body too much. That drag the back, right? So sports that drag the back, they should try to avoid, right? And pushing and pulling, try to avoid that because it act up the back, pull up the back. So they have to try to avoid the push and pull, right? Such as horse riding too, they should avoid horse riding. Cause and the horse going up, it shake up the back and shake up all the procedure that already been done, the surgery, and so the screw then start drop out and complications start again, and all these things have to start over again. The child in a pain and problem all over again, and it even get worse, right? So the child have to avoid this pushing and pulling and us riding and the jumping and all. You have to just take it easy, right? Take it easy and take time go on with life. And contact sports for a year, right? All right. In some cases, they may need to wear a back brace for about 6 months to support the spine. So after that finish with them, the surgeon finish with them now, pin up and all of that. They say that they want to put a brace now, for 6 months to support the spine. So after wiring up and bolt up and all of that, they put a brace now to support the spine. Because them don't want it to just let loose, and shake out back. Yeah, yeah. Let me see what's going on here. We have 4 million beautiful people in the building. Make a little shout out to all of you. Thanks for coming, guys. Yes, and I see the chat here. And Ishmael drop his link, and Mumi is in the building saying, Valley not sleeping. Okay, thanks for coming, Mumi. She said, Valley, I'm not sleeping. And Valley said, Mumi, I there. And here Vibes drop early. Vibes, do you have Mumi? Grab all the new persons them in the building and grow, grow, grow. Right? And here is Mumi saying I to Ishmar. Right? So we have 4 million beautiful people in the building. Mega love shout out to you all. Thanks for coming, guys. All right, let me see what Vibes doing here. Vibes with Maria. What's going on with her here? Let me take a look at Vibes. Vibes with Maria Coleman. All right. Really? Are these no song? Vibes? Vibes are lower on subscription, man. Oh my goodness. Guys, 4 million people in the building. I wonder how Valley stay now. Today I saw Valley and Valley was so low. Oh my goodness. When I saw Valley's subscription, I said, really? So vibes with Maria Coleman. Oh gosh. Oh gosh. Guys, we need to try and get Vibes up to 100. Oh my goodness. She only have 66 here, guys. Vibes with Maria. Oh Lord. Coleman. And she have 66 subs. I never know so low you be, Maria. And to that saw Valley. Oh my, Valley is so low. Valley was 70 something and course take her up to 100 and something. Okay, so we have 4 beautiful million people in the. Hi, Merlina dear. Welcome, welcome to the live. Welcome, sweet, sweet Marlena. Thanks for coming. Mega, mega love shout out to you. Yeah. And mommy say, Maria, I visit you. Yes, mommy. Give her something there, mommy. Please. Please. 66. I didn't know that she's so low. Oh my goodness. Oh my goodness. I'm Valley too. Valley low, man. Ah, Merlina, mega love shout out to you, my sweet sister. Thanks for coming and thanks for that beautiful thumbs up. Merlina, honey, can you please give my sweet friend ear vibes in the chat a full pack and she will return? Maria, Maria, you have to work, you have to work. When person come to your house and give you, you must give them back, right? Mummy, do me a beg you. Build up Maria. Build up Maria and Maria, please return when they give. Let me put her up here so. For Maria day. Oh my goodness. One pinner. Alright, replace. So guys, here is Maria at the top of the chat. Just jump on her and give her full pack, guys. Please. Connect with her and give her full pack. Please, Merlina, help. Genus the same. Genus, I saw your number today. Not too bad. But here is Maria of 66. Guys, please jump on Maria. Jump on Maria, guys, and give her full pack, please. Help her to 100. She may not get the 100 tonight, but bring her up. Bring her up to even 70, 70 or 70 something, because she had 66 now. Yes, yes, Genus, please. And Maria, please return. Please return. Right? So, Genus, oh my goodness, here is Yard Food. Welcome, welcome, Sissy Yard Food. Mega, mega love shout out to you. Guys, remember to give the host a thumbs up. Yes, guys, as you comes in, Yard Food. Yes, Yard Food. Yard Food. We have vibes with Maria Coleman in the building. She only has 66 subscribers. We want to take her up to 100. As close as possible to 100. So, guys, please, please. So, we have Merlina. Please, my sissy Merlina. We have Genus. We have Yard Food. And Mummy, that's 4. That would take her to 70. Right? Here. Who else in the building here? Please, guys. And vibes with Maria. Look at me. Last night when Natty Slim came here to the live, Natty Slim see me take up my book. And she said, self-care, what is that? Is that YT Bible? Guys, Natty Slim said, self-care, what is that? Is that YT Bible? Guys, I laugh till I drop off of this chair here. I laugh so till. I said, Natty Slim, that's a good one. Yes, it's YT Bible. Yes, so guys, please, please, Maria, you should have a YT Bible. Everyone's in YT world should has a YT Bible. So like now, Maria, you have your book, you have a book with you. Whoever comes in your house, I'm asking Merlina, I'm asking Mommy, please, I'm asking Genus as well as, oh again, Yard Food, please go over and give Maria, bring her up to 70 and more, guys. Please, oh God, 66, 66. Guys, remember, we remember, yes. Oh, she said, have her Bible too. Good, good, yes. So when this person comes in your house, you write it down, and then like 2 days after, you return to everyone because everyone wants banana, just as oh you want banana. So you have to return back to them, right? So get your pen or your pencil and write in your Bible all of who you see in your house and return back to them in 2 days' time, right? Please, please, or 24 hours, right? In 24 hours, tomorrow this time you can return to them and do it full. So you watch a video of 4 minutes or 5 minutes, or if you see they have a video that is long, you make certain you watch 4 or 5 minutes out of it, make certain, and then you do everything, give them full pack so the banana stay. And that's what I hope they're gonna do for you now, because all 4 persons that are called out, they know exactly how to do it. So you must learn now how to do it. So when you see them, guys, please give our full pack. Beg you, I beg you now. 66. Remember when we used to roll, man, and we fight to reach 100. 100 was one of the, is the hardest thing to reach. 100. Hard, guys. A dear. My sweet, sweet, beloved sweet pea is back in the building. That's what coming. And she's there laughing at me as usual. Yes. So, Valley is saying, Genius and yeah, connect with me. I will return. And there is Valley too. She is very low. Let me see. Guys, please help them. Remember when we were small. Please, guys, I'm begging. Help. I never know that Valley was so low. Vibes was so low. Let me see what's going on with Valley. Valley cute. Oh, Jesus. Valley. CUTE. Please, guys, help them. They are so smaller than us and need help. That's why they come to us. And guys, you should go to the different LS. Alright, Valley, I see where you're going up. I hope all of these numbers are really set. That's tomorrow. I don't think they'll drop off. I hope them set. Alright. So Valley is getting there. I saw her today. I think she was at what, 90 something, somewhere there. But here is she. She went to the LS and she got some help. Right? So guys, please help Maria. Please. We have 5 million beautiful people in the building. Mega love shout out to you all. Thanks for coming, my beautiful people. And the topic we are discussing tonight is scoliosis. Yes, guys, we are all learning about scoliosis tonight, right? And CP is saying, I have white tea oil to cast them unwanted spirit out in the sea of forgiveness. They can't bother with CP, no. So what is white tea oil? And what kind of island? Me that me. And what kind of island speak here we are talking about? Why? I tell you every time sweet pea come in here, she kills me and she Bunny and Larry. I have white oil to cast them outside unwanted spirit out. Yeah. Yes indeed. Those bananas that coming, a monkey coming in to take our banana. Okay. So they are saying symptoms now of scoliosis. Symptoms of scoliosis usually becomes apparent from infancy or adolescence. So you see how far it coming from, guys? From infant. So your baby born, you should watch. That is why when time with the baby born, we take them back to the clinic, Yes, when you give birth to the babies, them at the hospital will tell you like 3 weeks after having baby, or 1 month, or 6 weeks after, which is a month and 2 weeks. Go back to your clinic, what you call a postnatal care, something like that. You go back to postnatal care where they the nurses there will take the baby and put them in scale to weigh them, right? And what they do, all babies born in that time, in that, date, on that date, you know, every one of those baby must be on a certain weight or body mass, how them growing and so forth. And if they see where the baby is not developing up, they will implement things for the mothers to fed the baby or so on and so forth. And that, in that type of clinic as well, they will take the babies and weigh them, because babies have to weigh a certain amount, you know. And if the baby not reaching the weight they want them to be, as I was saying, they tell the mothers how to feed the baby. Breast milk, breast milk, breast milk. Give the baby breast milk. Mother, feed your body properly. Eat good food. Feed your body. Give the baby breast milk, breast milk, breast milk. Yes. And the mother will, you know, hear what the nurses are saying and give her baby breast milk, and the baby will develop properly, right? And while at the same clinic too, they will take the babies them and put them on bed, right? Put the babies on bed and take their two hands and stretch it out to see that the two hands are equal. They will also take the feet and stretch them out to see that they're equal. They are looking for abnormalities, right? Abnormalities in the baby. They will take inch measure, the same inch measure that they use, and measure your clothes as a dressmaker or a tailor, and put it around the baby's head, guys, for Sweet Pea, that is here, Maria, and yard food that is in the building that I know have children. When you go to a postnatal clinic, that's what you see they're doing. The inch measure, and then put it around the head and measure the circumference of the baby head. So the baby head nothing too bigger than his age, right? To find out if there any abnormality. They're looking at the baby eye, they're looking at the nostril, then look if the deformity that the nose, if the nose turn the way when it's supposed to stay like this. Then look on the mouth, if the mouth touch so when it's supposed to stay like this. Then check the 10 finger, and then look if you have 10 finger. 10 finger, and if they're normal, or if they have two little one on the side, you're saying, oh, what? Oh, no, no, what's going on? Right? Yard food and sweet pea, you don't know. Yeah? Then looking at the baby mouth, if you see all the gum shape and the teeth, if normal, right? So they might look for abnormalities in the children then, right? Yes. So scoliosis usually becomes apparent from infantry. So that's where the nurses them supposed to start find fault and problem, the infant them going into the clinic, so they can send the mothers them or the fathers them, whoever, take the baby to the clinic to go for further help at the hospital, at the children hospital, you understand, or a specialist wherever, because deformity is coming, so they have to train the deformed, whatever deform they see in the child, right? So when you're pregnant, it's a must to start antenatal clinic. You have to go to clinic. No, you're saying you're going to clinic. Go to clinic, right? And after clinic, and after giving birth, you still have to go to clinic with the baby. Yes, so the baby develop properly, grow properly, like me and you, no default. Cool, guys? Yeah, the symptom differ depending on the person's age, right? So them say symptom. Scoliosis usually become apparent from infancy or adolescence. The symptoms differ depending on the person's age, right? So if the baby at 9 months are smaller, the symptom is different from the ones them that are 10 and 12 going up, right? Symptoms in adolescent. The most common form of scoliosis appears in adolescent and is known as adolescent idiopathic, meaning that it is unknown. Adolescent idiopathic scoliosis. It can affect people between 10 and 18 years of age, right? Right. So, children between 10 and 18 years old, adolescent, can develop scoliosis. They don't know how it happen, right? You're not born with it. When you go to clinic after your mother give birth with you, you never have no scoliosis, right? But while growing up in adolescent, 10, 12, 13, 14, 16, 17, 18, so they find out that your back twist like this. I saw you twist. Eh? Yes. So you go to the doctor, doctor wonder, who you have this and you never born with it? Why you twist up so you never born with it? Yeah. Yeah. So symptoms can include the following. The head may appear a bit off center, right? So the head no center like when you see my head center, look pound. The head goes so. Then the body twists so. Right? So symptom can include the head may appear to be a bit off center. So it's not center. It's off center. Right, guys? Yeah. The ribs on each side may be slightly different heights. So your ribs not straight, slightly different height, right? Your ribs not straight as how it's supposed to be. See it here, guys? You lean. See there? Your ribs, you'll twist, you lean, right? You're not straight like how you're supposed to straight up here. So, see there? Normal vertebrae, scoliosis, vertebrae twist, C and S shape. You can see the C here, and you can see another, twist there. So it's a S shape, right? Cool. Right? So the spine, so it's an uneven shoulder, right? So you look here, it's a uneven shoulder. See the right shoulder here? Normal shoulder, uneven shoulder. So you drop like this, scoliosis. The spine twists C or S shape. So this is scoliosis, right? Then now it's saying uneven shoulder that I just show you. Curve in the spine. So it's the spine, curve in the spine, right? Curve in the spine. So see the spine, curve in the spine, right? Right? And then it say, so that's signs of scoliosis. And here it say hip. See a hip here? Curve in the hip. Uneven curve in the hip. So what? Yeah. So uneven curve in the hip. So you will shape like this. So the spine affected, the hip affected, the shoulder affected, I should say. The shoulder affected, the head affected, the hip affected, and the spine affected. So you shape like this. Scoliosis. You understand? When you're supposed to shape like this. As an adolescent, the poor child developed scoliosis. Unknown, idiopathic. Doctor wonder, oh, him never born with it, or him have scoliosis. Sometimes, guys, I think is load. You carry load. You know, when you go to the market and you have to buy one bunch of banana and carry home the bunch of banana there, and you put it on your head, or you got country in the bush, you got a bush, and you cut the banana, and you put it on your head, or you drop it on your shoulder, or the crocus. I just saw Blooming in the chat here. Welcome, welcome, Blooming, daughter of Zion. Glad to see you. Thanks for coming. And there is yard food, and there is vibes. Vibes, you guys know what me talking about. Going to country and in the, I'm going to, living in the country or going in the country. Going to bush. Yes. Where we go and chop the banana, bunch of green banana, and we dig the yam and we pick the breadfruit them and we put them in a big sack, and then we throw the sack on our back, and we lean the side and we head lean gone so if we carry the back, go down the hill, so to reach home. I think that's one of the reasons why the back twists and the head lean so. And we put the banana upon our head, a bunch of banana or a bunch of ripe plant or green plant, and we head shrink and we go down. Yeah, and those things help us, to farm deformity. Yeah, the body can't manage the weight. So we pack down the body, we shrink our waistline and shrink the spine. You understand? And we mash up the body. Yes, guys, I think that is one of it. Yeah, yeah. So adolescents, 10, 12, 13, 14, never born with it, but at the same time develop it. So Dr. Wondering is what I say it is idiopathic. Idiopathic. So it's unknown, right? So symptom can include, it said the ribs on each side may be slightly different heights, right? One short and one tall. One it may be more prominent than the other, right? The clothes may not hang evenly on you. So your clothes not fit you properly. Guys, remember to thumbs up the life as you come in. I think I see Ayana in the building. Ayana Fashion in the building. Welcome, Ayana. Guys, please welcome our new visitor. Ayana is not new, but maybe to some of you guys, welcome her and visit her. Guys, please remember, there is Valley at the top of the chat there, guys. Please jump on Valley and build her up. She's only 66 subscriber. Ayana Fashion, could you please give Valley a full pack for me? Please help out our sister. Blooming, I'm asking you as well. Jump on vibes and build her up. Build her up. Remember when we all was going towards 100 and couldn't meet it? It was very hard. I can speak for myself. I'm telling you. When I supposed to read 100, it take me some weeks. Weeks. As some get the 100, I saw it drop down. Yeah. So all person coming in now, please jump on this link that is in the chat and let us build up vibes. She is only 62, 66. So we need to build her up, right? Please, I'm asking you guys. Yes. So the clothes that you may have, the clothes that you put on your body, because of the scoliosis, when you put on your clothes don't fit you straight like how it fit me. It just turns so. Your clothes just hang. You know? Can't give you a proper fitting. It just hangs so. Right? Yeah. So your mother may not pick up that your back is twist. Right? But seeing you walking and your clothes, in your clothes, and she see your clothes and she said, what? How your clothes sit so on your body? Your clothes not firm on your body. Why you twist like that? Why you look like that? So she realized that something is wrong with your back, with your body. Then she will start, if some parents are smart, they will just start to take it, to the doctor there. So to see what is going on. While some parents, I don't know, well, they don't take things in hand fast, right? Yeah, so one shoulder or shoulders blade may be higher than the other, as I was saying. So they say that one shoulder or shoulder blade may be higher than the other. So that is scoliosis when you see person looking like this, right? You go into the street and it's person looking like that. So the person may lean to one side. The legs may be slightly different length, right? So they're saying that scoliosis, people with scoliosis, their legs are different length. So you have long and short. So person where you see hip hop like some of them is scoliosis, it's long and short leg. It is scoliosis, right? So some children born with it, some children develop up after scoliosis, right? Some types of scoliosis can cause back pain, but it is not usually very painful. This symptom is more common in older adults. So they are saying some types of scoliosis can cause back pain, right? but it is not usually very painful. This symptom is more common in older people, right? Older adult. So in older adults, you will find they're getting back pain, right? Yeah. So symptoms in infantile, right? Symptoms in infantile, a bulge on one side of the chest. Oh my goodness. So symptoms in infantile, so infants that have scoliosis, you will see bulge I'm saying in the chest. So if you see bulge in the chest, you know that is scoliosis, right? Because you know the infant, them can't really stand up straight and so on for you to see the back twist. But you will see bulge in the chest. To all the back twist, he push you in. He push you in them, you know? Yeah, so you will see the bulge in the chest, right? In the chest, right? So they are saying no. Consistently lying with the body curve to one side. So they are saying infant lying, you know, they're lying on their bed consistently lying with the body curve on one side. So if you see the baby lying with his body curve on one side, each time you put him down, every time you put him down, he just go on one side and curve up in body. Check it out. Check it out, mothers. Yes, parents, check it out. Right? So these are some of the symptoms in infantiles, right? So in an infant does not receive treatment for scoliosis, there will be more of risk of problems later in life, such as impaired heart and lungs function. So you hear what they're saying? Mothers, parents, you must take note to observe your children. Yes, be observative in your children when you're bathing them, when you know whatever you're doing towards them. Observe how they look, observe how they shape, you know. Observe how they walk. You're looking for normality. Just look for normality. If it's normality, you know, it's abnormality in them, right? You just watch them grow. So if an infant does not receive treatment for scoliosis, they will be more at risk of problems later in life, such as impaired heart and lungs function. So if you see any abnormalities, mothers and fathers in the children them, in the picking them, bring them to the doctor. Bring them to the doctor, because later on they will have heart problems and lungs problems. So bring them to the doctor. Then body twist up, then can't breathe good. You know? No oxygen now go to the heart. No, you understand? Then can't breathe good. Them are go dead, you know, while you're picking it then dead. So you have to take care of them, observe them, look for abnormalities in them. Yeah, take them to the doctor. Right, guys? Causes. Neuromuscular condition. So this is causes. So they are saying neuromuscular conditions. These conditions affect the nerves and muscles, right? They include cerebral palsy, polymyelitis, and muscular atrophy, right? Atrophy. So they're saying that causes, right? So scoliosis causes neuromuscular condition, right? These conditions affect the nerves, right? They affect the nerves of the children, the baby, then shake. Okay, yard food. Thanks for coming, sweetie. Thanks for coming. Did you give Maria that full pack for me, sweetheart? Please, thanks for coming and get some rest. I know you have work tomorrow. All right? Thanks for the beautiful thumbs up as well. Right. So it's saying that Neuromuscular condition. These conditions affect the nerves. Baby then shake. Can you imagine the poor baby them a shake? You know? Because the scolosis, it affects the nerves, right? And the muscle weakness and nerves problem. And them poor baby they can't exercise to get the muscles up back, right? They include cerebral palsy, so the poor baby them just lie down one place, helpless, you know, sickness under their skin, them a, you know, pain, yeah, you know, polomyelitis, yes, weak muscles, guy, them can't stand up straight, polomyelitis, muscle weak, shoulder drop, pelvis weak, can't move them foot, yes, 1 foot long, 1 foot tall, 1 foot fat, 1 foot mager, one hand mager, one hand slim, you know, fat, one slim, you have a normal hand and you have an abnormal hand. You have a normal foot and you have an abnormal foot. You have a normal shoulder and you have an abnormal shoulder. Yeah? Polomyelitis and cerebral palsy and muscle diathropy. Your muscle weak, can't firm up, can't stand up. Yeah. So guys, look good. Observe your children them. Observe them every day. Be them, check them out, watch them, looking at their eye, nose, every part of them. Yes, guys. So then say congenital scolosis, right? Congenital scolosis means that the condition was present at birth. So we have 5 million beautiful people in the building. Make a love shout out to you all. Welcome to the land. Keep coming, guys. Keep coming. I can see Daddy in the building. Welcome, Daddy. Welcome. Yes, so Ayana is here. Blooming is here. Vibes is here. So I'm back. And Vibes say, oh, they don't watch the video because the views are not moving. Only the banana. Oh my God. 5 guys, watch 3, 4, 5 minutes no man and let you get the banana no man. Just watch. Oh my Jesus. Alright, sweetie, don't worry. Maybe it not kick in yet too, you know. Maybe it not kick in yet, Maria. Just watch it. Alright? Maybe because all these persons that are sent over, you know, these persons know what to do, how to do it. Right? So Sweet Pea saying, yeah, if you set yourself up to ask for fruit, then that's all you get if you set yourself up for views. Then views you shall have. Your channel you decide. Alright. So here is, alright. So Genius is saying, I watched 2 of your videos. The one with the baby dancing and the one with the man a creamier ear. Alright. So Maria just settle. It maybe not kicking yet. Settle. Okay? Okay. Thank you guys. Cool. You know kicking yet, man. Cause I know they're supposed to all who I send over your house, they can do it. Then they know what to do, exact what to do, right? Alright, so Daddy Cool is in the building. Cool Daddy, make a love shout out to you and he drop his link. And Cool Daddy say from Philippines, cool. And Vibe say, oh, so I see them in the comments. Right. I know them. I have all of them. Right? So tomorrow now you will see what you really got. Right? Alright, so you write them down. Lucky Star. Oh, this is not the bed. No, sir. I wonder if it's still here. Lucky. Lucky Star Global in the building. My bro. Eyes, oh, thumbs up. Done. Thank you for that beautiful thumbs up. Good morning, beautiful people in the... Welcome back, Lucky. Welcome. Lucky, you come look for me. Long time. Lucky, I'm glad to see you, man. Happy to see you. Happy to see you in my tea world. Wow. Wow. The other day you came and looked for me and said, self-care, I'm back. And all I'm looking for, you can't see you. Now you come back now to say, hello, beautiful host. Thanks for coming, my brother Lucky. Welcome, welcome. Long time, man. Oh, my goodness. Are you still doing YT here? Are you still doing vlogging and all these things? Why, Lucky Star? Oh my goodness. I'm happy to see you, Lucky. Yes, happy to see you. Lucky Star Global. Let me see what's going on with Lucky. Welcome, guys. If you don't have Lucky, check him out, guys. Check him out. Let me see what's going on with Lucky here. Lucky is my bro, guys. Gone the days when we used to roll together. Oh my goodness. We have some time. Oh, I'm telling you, I'm telling you. We have some time there. When all of us used to roll together. Lucky Star. I'm so happy to see you, Lucky. Sweet Pea, remember Lucky? Where is Sweet Pea? Sweet Pea, here is Lucky. Lucky Star Global, and he's sending his love. Yes, our beautiful host, and he's sending his love. Let me check you out, Lucky. What's going on with you? Here is Lucky here. All right. Lucky seems like him not pushing. All right. Oh, Lucky is Batman. One day ago, appreciation video. One day ago. Yeah. Lucky you come. Lucky you come back fat too. Oh my goodness. Fatter than before. Good to see you, Lucky. Good to see you. Happy to see you, my bro, my bro. I have your hair running. I'm going to watch you later. All right, Lucky. I have your video here. Appreciation video. Right? So I'm going to watch you. Watch you later. Your appreciation video. All right? Gonna watch it later. I'm gonna let it run. All right. Glad to see you, Lucky. Glad to see you. All right. So we have 4 million beautiful people in the building here. Lucky. I have a friend up here, my beautiful sister here in the chat. Lucky, can you go over and give her a full pack for me, please? She's pinned right up here at the top. Help out your sister here. Good morning, beautiful people in the chat coming from Lucky. Thank you so much, sis, and welcome, sweetheart, Lucky. Can you go up to the top of the chat here and give this young lady a full pack? She only has 66, maybe 70 by this, because I sent person over here. And Maria, please take not no to return back the flavor full pack, Maria. Okay, so Lucky, please go over there and give her something for me, right? And guys, if you don't have Lucky, what are you waiting for? Yeah, man, Lucky is a hard-working gentleman, I'm telling you. All of us used to roll the sea. Blooming, if you are here, you know Lucky. Yeah, man, all of us used to go under the stress and we bad in a YT world. Yeah, we cry. You know, why, bro? Okay, so let me get back to the notes so I can finish up quickly. All right, what time is it? Ooh, I'm in my 2 hours. I wanted to spend 2 hours, right? So it's a congenital scolosis, right, guys? Congenital scolosis. Congenital scolosis means that the condition was present at birth, right? So the condition starts from inner the mother womb with the baby, right? Scolosis is wear at birth, but it can occur if the bones in the spine develop abnormally when the fetus is growing, right? Hi, Mission TV. Welcome, welcome to the live. Mega, mega love shout out to you, sweet Mission. Welcome. And she's clapping all the way. Yes, yes. Thanks for coming, sweet Mission. Love you, love you, love you. Yes, and Lucky is saying, all right, awesome. On my way, on on the way to my office. Once I get there, I'll visit you guys. Yes, man. Please visit Maria. Please, please. Welcome, welcome, Mission. Mega, mega love shout out to you. Love you, love you. Thanks for always coming, sweet Mission. Yeah. Thanks for always coming. Yeah. Yeah, so they are saying the congenital means that the condition was presented at birth, right? The condition was present at birth. Scolosis were at birth. Oh, the condition was presented at birth. And then this is scolosis is rare at birth. But it can occur if the bones in the spine develop normally when the fetus is growing. Okay. So the baby born with scolosis. Reason being is because when the baby was developing in the mother womb, right? The bone in the spine, they're saying it occurred during the scolosis were at birth. But it can occur if the bone in the spine develop abnormally when the fetus is growing. So they are saying scolosis occurs in the womb, right? The fetus develops scolosis because of the bone not developing in the spine, the not growing properly in the fetus. So while the mother pregnant there, while the mother pregnant there and the fetus is growing, the bone in the spine not developing properly, right? So the bone in the spine twist up while the fetus is growing. Can you believe it? From in the womb, while the fetus is there developing, the spine not developing properly, abnormality it having. So the spine are twist up inside of the womb, and so the baby, from there scolosis start to develop. So the baby, born with it. So congenital means that the condition was present at birth. Yes. So the baby born with it. Congenital means that the condition present with birth. So it started from within the fetus inside of the mother, and then the baby born with it. When the baby born, now the doctor them take up the baby, and after the baby comes out, the mother doctor them take up the baby and wondering why the baby is like this, and by stretch out the baby right there and then on the bed, they present, say something is wrong, some abnormality, the baby sick, right? During pregnancy, the spine have damage, right? So this baby now, when the mother coming out of hospital and give her all kind of reference, say, take the baby to this there, or take the baby to there, so, or whatever, because baby having problem. Yes, that's how it go. Congenital, right? So it happens within the womb. That's what congenital means. Okay, so Mission, here is Vibes asking you to visit her. Hi, sweet Mission. Mission said hello. So specific genes now, specific genes. It is believed that at least one gene plays a role in the development of scolosis. One gene? Specific genes. It is believed that at least one gene plays a role in the development of scolosis. Leg length, right? I'm talking about leg length here. If one leg is longer than the other, an individual may develop scoliosis. Yes, as I was saying before, the nurse straighten out the baby foot, or the doctor straighten out the baby two legs, they're measuring them. They are not equal like this, they are like this, long and short. So they classify that as, some form of scoliosis right there, right? Long and short foot. So syndromic scoliosis here. Scoliosis can develop as part of a medical condition, including neurofibromatosis, right? Telling about them science word there, that mash up your tongue. Syndromic scoliosis, right? So scoliosis can develop as part of the medical condition, including neurofibromatosis or Wolfram syndrome, right? So these are two medical conditions. Them say it can develop from these two medical conditions, right? Neurofibromatosis and Morphan syndromes, right? So they're talking about osteoporosis now. Osteoporosis have to do with scalo scoliosis, right? So osteoporosis is bone problem. So osteoporosis can cause secondary scoliosis due to bone degeneration. So your bone a go down, bone weak, the bone a deteriorate, right? So osteoporosis can cause secondary scoliosis due to bone degeneration, right? So you don't have to born with scoliosis, but due to bone degenerate degeneration right? Bone damage and decaying and all of that, scoliosis appear, right? Yes. So osteoporosis is a bone condition, and it bone degenerate causes, you know, scoliosis, because the bone weak, the bone a go down like you have some, brittle bone or something, yeah, and you just, start to twist up, yeah, you will get scoliosis right there. So other causes, they're saying poor posture, carrying backpacks or sacks. Hello guys, it come right back to what I was saying. Them saying other causes, other causes, poor posture, right? Not sitting up properly, poor posture, carrying backpack, like vibes in the building. You should know what me talking about. We go to school and we carry our knapsack bag with whole heap of book, we pull on we back. Yes, when we go to school, whole heap of book and answer that's something in our knapsack bag, pull out the back, can cause scoliosis, as I was saying earlier. Hear them saying our sashes, our sachels, right? As I was saying, living in the country, vibes, living in the country, going to the bush, put the banana away, the bunch of banana, bunch of plant, we heavy, we shrink we head down in our, in our body, or turn your head so, damage our spine, right? And cause us to have scoliosis. The sachet with the yam and the breadfruit and all, so we swing across the back, give with the scoliosis. See them say it right here, as I was telling you before, that can cause it. And see them come and say, yes, poor posture, carrying backpacks loaded with books or such, or sachets, with the yam and the banana and the cocoa and the dashi, and you fling across your back, you got a bush way up in the hills and the valleys in our Jamaican, you know, language. You got a bush. So go put breadfruit, coconut, and all that something and throw in a bag and fling it across instead of make the donkey or the, ass or the cat carry it for other persons that in the chat here. Yeah. Yeah. So connective tissue disorders. So these are the things that we get. And some injuries can cause spinal curvature. So other causes poor posture, carrying backpacks or sachets, connective tissue disorders, and some injuries can cause spinal curvature. Right, right. So risk factors. The risk factors for scoliosis include age. Signs and symptoms often start during a growth spurt just before puberty. So they're saying risk factors. The risk factors for scoliosis include age, sign and symptoms signs and symptoms often starts during a growth spurt just before puberty. So you have to watch them when them are grow. When they shoot up, you have to look if them abnormal or they normal, right? As me say, from the baby's born, watch them, observe them, how them grow. In case you see any deformity in them, rush with them to the doctor to find out what's going on. So they're saying that gender, females have a higher risk of scoliosis than males. I saw a man, I saw a man with scoliosis. I saw both of them, yes. I saw a man with scoliosis, him straight like this. Yeah, man, yeah. But they say that female more have scoliosis than man. Yeah. Genetics. People with scoliosis often have a close relative with the condition. So genetics now, it can be in the family gene, in the genes, you know. So your mother or your grandmother or somebody down the line there had, have scoliosis, and then hope now in the generation, as it. Yeah, yeah. So it can be in the in the genes, yeah. As they say in here. Types of scoliosis. 3 million beautiful people in the building. Let me see what's going on. 3 million beautiful people. And I'm seeing pretty mommy in the building. Welcome, pretty love mommy. Welcome. Mega love shout out to you. And here is Sarah King in the kitchen. Welcome, welcome, Sarah King kitchen in the building. And she's saying, I host. Welcome, welcome, Sissy. And she said, thumbs up, done. Thank you for that beautiful thumbs up, Sissy Sarah King kitchen. And guys, Maria, if you don't have Sarah King kitchen and Mummy, grab them. Mummy, Sarah King, Mummy and Sarah, Pretty and Sarah King. There is vibes up the top of the chat here. Young YouTuber just coming up at 66. I asked some person earlier to to build her up, so I guess she may be in her 70s by now. If you guys can please jump on her and give her full pack for me, I would gladly appreciate it. And Maria, please take note and return tomorrow these hours, right? With comments so they can see you, right? Full pack, so when they look in their notification, they see you subscribers showing up as all they gave to you. Please, guys, build her up, build her up. Thank you, thank you. And here is Sarah saying, hi everyone, and Pretty Mummy saying, like and share done. Thank you, sweet Pretty Mummy, thank you. And Sarah is saying, thanks sis, one love, my sweet Sarah, thank you. Mega love shout out to you. Let me finish up here with the notes because I want to finish the live anytime now. So it said types of scoliosis. So there are different types of scoliosis, right, guys? You have congenital scolosis that I just talked about. Yes. You have early onset scolosis. That's another one. Adolescent idiopathic scolosis. That's another one there. Degenerative scolosis. That's what they're talking about. The bone you know. Yes, and neuromuscular sclerosis, I just talk about it too, right? Affecting you from your brain go down and so on and so forth. And they are talking about this one that I'm not really familiar. I have to go look up this one. Um, Squisherman's Sclerosis. Squisherman's Sclerosis. Right, and you have syndromic sclerosis. So I just talk about that one too. So I did talk about this Cushman sclerosis. That's one so new and the early onset. All right. So that's the types of scoliosis. They have 1, 2, 3, 4, 5, 6, 7. Congenital scolosis, early onset scolosis, adolescent idiopathic scolosis, degenerative scolosis, neuromuscular scolosis, Schusterman's scoliosis, yes, and syndromic scolosis. Yes, guys. And here ends the end of the note here. So let me show you guys what I'm really talking about. This is scolosis affect persons like infantile baby born twist up or infant like maybe 9 months up to adolescent or have it after a while, right? So this is the normal spine, normal vertebrae going down to the spine here. So this is the normal vertebrae, your normal like me and you. And this is personal with scolosis, the C shape here, right? And it give you a S shape down the bottom. So you have a C shape first, then it go down now and give you a S shape. So this is scolosis. So scolosis here and normal spine and vertebra here. And here they're showing persons with scolosis now will have uneven shoulder, right? Uneven shoulder blade. So here is the uneven shoulder blade. This is the scolosis shoulder, and this is the normal shoulder, right? And this is the vertebrae, abnormal vertebrae, and here is this C, the scolosis in the vertebrae, the C shape here, and then they show it over here now, uneven spine, right? So it's uneven, an uneven waist. Yeah, so this is scolosis. Twist up, person twist up like this. Yeah, scoliosis. They say that more women are affected. Female are more affected than men, right? Than male, right, guys? So here, hence, so it gives you uneven hips, curve in the spine, uneven shoulder, right? Scoliosis. So, guys, here end my notes on scoliosis. Glad I've got the chance to share it with you all and all of us learn together. Right, guys? Yeah. So Pretty Love send her love. Thank you, Pretty Love. Yes. So hope all of I learned something. I learned something because I didn't know much about scoliosis. Yes, I know a little, but not so much. Yeah. So I'm learning with you guys. Who we have in the building here? Medidan Music. Welcome, welcome, my sweet Jamaican bro. And he sends his love. Thanks for that beautiful thumbs up, Medidan. Wagwan. Wagwan, brother. All is well. All is well with you. So Medidan has came in when I'm looking to come off the chat. Tired now, guys. So Vibes, are you still here, Vibes? So Medidan say yes. Welcome, brother. Welcome. Medidan, do you have pretty loves? Here she's sending her love. Do you have pretty love? Need you WhatsApp. You need my WhatsApp? You on IG? Are you on IG? Medidan. Medidan, if you don't have pretty love mummy here, you're on IG. Alright, here is my IG contact. Let me send my IG contact to you. Okay, see it here. See it here in the chat. So we connect from there, alright? Oh, you add me? Alright, so since as you had me there, Medidan, leave your number. Go over and leave your number and then I will add it to the alright, cool. So go over now and leave your number by IG and then I will add it to WhatsApp, alright? Yeah, cool. If you don't have pretty love mommy, connect with her. She will return definitely. And there is Sarah King as well. Return, connect with her and grow. There is Vibe Spin at the top there. So we have 3 million beautiful people in the building. Okay, Medidan. So connect there and then I will take it from there. Pretty love, are you here? She's searchable, on. Pretty love, are you here? Drop your link. If you are here, pretty love, drop your link. Do you have vibes? I pinned vibes up the top of the chat there. Do you have vibes with Maria? You could jump on her and give her full pack for me. She's just at 66. And I sent some persons over there, so she's supposed to out of 66. So you could just please jump on her and give her full pack for me. Let me check her out and see where she reach. So I must check out back. Go watch Lucky Star later. Lucky Star Global. Alright. Let me see what's going on with Maria. I never know that Maria was so low. I thought Maria was in her 300 and something. Oh my goodness. Wow. $68, you got 2 right there. Oh my goodness. Only 2 then give you. Only 2 you get, Maria. Maria, in this YT world, you have to work, During the days, I send out a whole heap of person who have been there LS, during the days and looking for you people and that. The thing about it, when we connect with Maria, connect with me. I notice you're not connect with me. Connect with me. Go and give me full pack. I give you full pack. Go and connect back with me. Full pack. So when I send out when I share persons LS, you can see the sharing and come over. I tell you about this. You guys have a serious. If you are in white, or they have a serious, guys. You know, have a serious. You come for grow, grow. You drop your video and you go look for people to connect with. Because during the day, I share out a lot of person And I'm looking for you guys and not soon. No, no, no. The only person I will buck up in is Valley. Valley. Oh, Valley, I work hard. I was at a LS today and I share out the LS. And 2 there was Valley in the LS. Eh? And the host tell the people them for jump on Valley. Because she was so low. Yeah. Guys, you don't have to visit LS. Anywhere LS there. Anywhere the banana them there. We don't have to march like we no mad. We tell you all the while. See Lucky Star come, them can't tell you. See Blooming come, they she could have tell you. Monica Miles in the building, she could have tell you. Sweet Pea, the whole of them can tell you the whole of we book up one place in our time. The whole of we in our time. Pretty Love, see Pretty Love there, see Sarah there, all the way. Right? When we connect to no have to connect back and have to put on no bell. Because a person going to share out what they want to come. They share out, come, hold up a banana, yes, so. I can understand that you give and you not get back, it hard. But you can't give up a so white world still. All of us tonight, alright. So, thank you guys for coming. Thank you guys for staying up with self-care. Guys, it's hard, If someone there every night I talk to them, I must come in, but you want to help and, I have to continue up with YT and YT foolishness. I could have in my bed now and doing something else, but I say I'd rather come and give back to those who, need the help and so. Me asking you guys, in order for no grow on have to find the banana where they find them. Hurry up and get them before no 1 year. Me not reach 1 year now YT yet, so far me reach, guys. Me not reach 1 year now YT yet. I must see next 2 months before my 1 year. You have to work hard. YT is another business, another work. You have to YT 24/7. God bless the little sleeper we get. Morning, noon, and night, YT. Yes. We achieve. That's how we go. That's how I went on the chat here and me see my friends them come up. Me have them, me know them, so me say no jump on new people as you see them come. Give them it and then go no back. That's how it go. That's the only way you will grow and conquer this YT and we start earn some money. So you see me sit down here, it's hard, because I have to work hard to start earning the money. I have to work hard. I don't know everything in a YT. I don't know nothing. I just know a little tubes. And a little tubes I know. I just try to come tell you. And I have to go to the LS, them at daytime, and then them LS, they know, the host like myself, them know a little tubes too, and then share it. Yes. Most of them share it while most not share anything. So you have to grab what they must say. When they roll, you listen. You listen because they might teach you at the same time. Don't just go roll. Listen. They might teach you there's something there that you want to know. Yes. So you will come here so you learn peace. You will go over Tom Jones and you learn peace. You will go down to Ari and you learn peace. And you go to Miss Jane and you learn peace. And the whole of them peace, they bill you. And so we do it in our time. Bill we. And hard no we bone. And hard no we flesh. So when time we go some places and then eat with banana, nah give we just say, cho. Forget about the banana. They keep going and gone again. Yes, man, guys. That's how it go. But anyway, I come to the end of tonight live. Thank you all for coming. Thank you all for listening. Love you, guys, as always. Yes. So as I always say, guys, may the peace of God go with you and also with your family. Our peace of God be with you as well as your family. Guys, in everything give thanks. In everything involve God. Whether it is good or bad, remember Jesus, and him alone can help all the way. Right? If we sick right now and we ball, who we are ball out for? Jesus. We not call out for mommy, daddy, or brother and sister, uncle and nephew or friend. The first word drop out of our head, Jesus! How about me? How me feel so? Pain all over me, Jesus! Daddy and mommy can't help you. Them present is there, but they can't help you. Worse when you live alone. They make you a phone call, and when you hang up the phone, are you alone? You alone and God. So you have to hold on to Jesus. If they even come visit you, after him gone, and who are you? Are you alone and Jesus? All them something they make me think and say, my God, when I was coming into this world, it was me alone. Me alone. And when me go in, it will be me alone. Because when they bury me, put me under the ground, everybody turn them back. And me alone in the cemetery with the other dopey them. And me alone in the cemetery with the other dopey them. You see? So you have to hold on to Jesus. Hold him close to you. Yes. You have a little problem. Somebody go down the road go tell Tom, Dick and Harry, because sometimes Tom, Dick and Harry not really with you. You know? And next thing you hear, say they up the road and around the circle. They say, Jesus, hold on to him, call out to him, and go him alone can't help we. Now say you have a good friend still, you know. But Jesus, hold on to him. Hold on to him. When me have my problem and my stress and me feel like me head I go bust and my heart I go bust. Me say, my God, Jesus, anyway, they come, help me. Help me. Me have to hold on upon him. Me have to hold on upon him and pray. And me settle down. And he heal me and he heal and he heal. And me just come back to. And me say, Jesus, me no want to cry. Jesus, me no want to cry. Because if me cry, depression I will take me. If me cry, me go stress out. Father God, don't make me cry. Me no want to cry. And he heal me. He hold me close to him. Guys, me I tell you something what truthful. Yes. Me try to make my circle small. Me no want hype. Me no want in this big nothing. Because next thing when me can't afford it and then something the head take me. Me just try to hold on to him. Keep my circle small. When me not have to fret and worry. I have no problem. Yes. Do the same, guys. Do the same. Know your limitation. Know your limitation. Right, guys? So as I said, go with God. Remember, guys, wear a mask when you're going out there. Right? Sanitize your hands. Don't go and touch the car door, the bus seat, the taxi, and then you put your hand in your face. That's a problem. That's a big problem. Right? You catch that thing and wonder how you catch it because you know you never go up in front, up what? Close and talk to anybody. Right? And you did have on your mask and you want, oh, me catch this thing, oh, me catch it. We don't know, me catch the hand, guys. Touch, and then member and go so. And the germs gone straight in your nostril and your mouth. Yeah. So, be careful, guys. Keep safe until I see you again tomorrow. 7:30, 8 o'clock, guys. One love. Peace out. Mwah. All the people in the bushes, love you. Love you. The Tracy Familia family in the house, and say thank you so much, host. Love you, Tracy Familia family. You just come in. Oh, you just come in, sweetie. Alright, I'm leaving now. See you tomorrow. Ooh, 5 million beautiful people in the building. Thanks for stopping by my house. One love, Tracy. One love. Remember to return the love. Return the love. I have some other person. I notice you guys don't come to me, You guys don't visit me, Me have to be walking on the down, but no worries. So I visit some today and I will be visiting some tomorrow. Alright? So remember you have to return to me back tomorrow. Full pack. Same as how I do you. Alright, guys? That's how you do it with everybody. Full pack. When you give person full pack, make certain you give them the comment, leave the comment, and when they look in their notification, they see you and they know that you give them the full pack with subscription, right? Everything done full out. And so we do it when we give full pack. Watch video from the beginning to the end. Like, share, comment, right? Subscribe are the last thing we touch, right? So do it same way. So we have some persons now for go visit. So when you see people in your houses, guys, return. If they leave a comment, send them back the comment then. If they give you a full pack, give them back the full pack. Cause then we send all them friend over and say, you know say Tracy legit. Yeah man, Tracy well supportive. Go give Tracy this. Remember me tell your friend Tracy see in our house, Tracy a come back at you. And that then do self-care, you know. Many times with people in my house, I mean, I wonder, who this, who send the person over here? You know? Them send them friends, sorry. Then send them friends straight in a self-care house. I tell us, go and go give self-care the full pack. Self-care, I give you back market, me tell your friend, self-care, see in our house and see again. If I ever comment, self-care, I give you back the comment. So once you see somebody in your house, you don't remember where you went and the person saw you and give you and now watch for say if you're coming back. Them not give you full pack, you know 3/4, them not give you full pack. Them just give you a comment for watch you. Yes, that's all they do it. Me love to give the full pack and me can't bother with the turning back. Say, alright, me give you a comment. Later on, me turn back and give you the full. Me not, no, son. Me just give you a full pack and done. You know, use your conscience and return back. So anyway, guys, I'm signing out now. See you tomorrow, 7:38, same time. Cool? One love, one love. All the people them in the bushes, big up on yourself, Sweet Pea and the rest, big up on a nice clean self. Yes, Maria, big up yourself. Big up yourself, Tracy, Valley, all the people them that come out and see me since night. One love. All right, so no.